St. Luke's Roosevelt Hospital Center, as a member of Continuum Health Partners, which include 3 other prominent institutions, including Beth Israel Medical Center, recognizes that this Assembly Bill A 6398, which requires coverage of medical nutrition therapy by health and accident insurance policies, is an important piece of legislation given where we are and what we see here at the hospital.
Decades of research have shown that prevention can save lives, reduce morbidity, and is cost-effective. Prevention works. This is a step, this bill, toward having that realized. I've brought together some of my colleagues who will share with you how prevention, and nutrition counseling in particular, can help their patients do better, feel better, and remain free of illness.
For some health plans, will cover nutrition for any medical condition that a physician deems is necessary to make a referral. And then there are others that will only cover for diabetes, and that's because New York State law requires that health insurance carriers cover patients with diabetes. And when a patient calls our office, we unfortunately have to ask them right away, well, what is your insurance plan? And then we know which ones cover what, and we say, well, I'm very sorry, your insurance plan will only cover you if you have diabetes. And the patient is invariably incredulous. My doctor just referred me. I would rather not begin expensive medications with side effects. Why can't I come see you? And we say, well, because in New York State, it's not required that your insurance company give you this coverage. And so we're supporting this bill because it would require that the insurance companies that write policies in New York State cover nutrition counseling. Some studies show as much as $10 saved for every $1 that's spent on nutrition therapy. It's necessary in New York State that we have this benefit, that Assemblyman Ortiz's bill become passed into law. It will be not only a benefit to the citizens of New York State and their health, but it'll also, in the long run, save money to the taxpayers of New York State.
What is called for a very simple thing. It's for everybody to be covered. Require that insurance policies and contract will cover this medical nutrition therapy. Very simple. We cannot continue anymore to have what Bob was talking about regarding asking patients whether or not what kind of insurance you have in order to figure out or find out that there will be coverage for that in order for them to offer these services. And it's the relationship between your physician and the nutritionist and the dietitian. They the one who can develop the process. And I will tell you this much. I have a lot of faith and a lot of hope that we will prevail.
I'm a stroke neurologist, so my job today here is to talk about and fight for brain health. So there are many things that we do in terms of prevention strategies. But one of the key things is modifying someone's lifestyle, modifying their diet. Because we can give all the medicines in the world, but that doesn't change if someone's eating improperly. Nutrition is key.
By the time the patients come to me, it's really very late. When we tell patients what can they do to prevent it, it's about, as Carolyn said, modifying your risks. And if we can get this bill passed so that patients can learn how to eat properly to avoid these risks, that would be the best thing.
In this aspect, nutritional issues are as important to the gastroenterologist as they are to any other doctor. Unless there are other health professionals with the required skills made available to assist in patient management, the overall benefits of all of our therapies are going to be compromised. It's as simple as that.
Diabetes run in my family. Mine is being managed right now through my diet and nutrition. I'm fortunate and unfortunate because of the diagnosis that my insurance allows me this opportunity to do something about my health, because I think everyone, regardless of the underlying health issues they may have, should be covered to go to a nutritionist. It shouldn't be because they're diabetic. Nutrition is important. It helped me. So I am a supportive of this bill because I want everybody else to be able to get the help that I am getting